Genesis IVF Advanced Fertility Clinic.
What are all the steps of IVF treatment, doctor?
Basically, the in vitro fertilization treatment has 4 steps. The first step would be to stimulate the ovaries with hormonal injection. What we are trying to do is that we are trying to make a good number of eggs grow in the wife's ovaries. The second step would be to retrieve or to pick up the eggs which have grown in the ovaries. So this is done using a transvaginal ultrasound. So the grown follicles are retrieved, the eggs are collected outside the body of the women. The second step would be to inseminate the eggs with the husband's sperm. Whenever the eggs are retrieved, the same day the husband is asked to provide a fresh semen sample. So based on the number of eggs available, good, healthy and motile sperms alone are selected from the husband's sperm sample, and we try to inseminate it into the wife's eggs. The third step would be to culture these embryos. The eggs inseminated with the sperms will be cultured in an incubator. In the next 72 to 120 hours, it will grow to be a viable embryo, and the last and final step would be the embryo transfer. So the grown viable embryo will be transferred into the womb of the women, and that step is called the embryo transfer. There are basically 2 types of embryo transfer. One is the fresh embryo transfer and the other one is the frozen embryo transfer. Now, fresh embryo transfer refers to the cycle whenever the embryos are transferred into the womb of the women immediately following the egg pickup. That is, maybe 3 days or 5 days following the egg pickup. In the same cycle, if the embryos are put into the uterine cavity, we call it fresh embryo transfer. The second type, the frozen embryo transfer, is being commonly practiced nowadays, wherein the embryos are transferred into the womb of the women a little time later. That is, we take a specific time period to prepare the uterus, to prepare the uterine lining, so that the uterus is more receptive to the embryos. Whenever we are trying to do a fresh embryo transfer, we may not have adequate time to prepare the uterus in particular. But whenever we are planning to go ahead with the frozen embryo transfer, we give specific pre-medications to prepare the uterus, and the uterine receptivity potential is also quite high, and that's the reason why frozen embryo transfer is able to give us a better success rate. But we decide whether to go ahead with a fresh embryo transfer or frozen embryo transfer based on the individual women's profile.
Genesis IVF Advanced Fertility Clinic.